Hey, welcome to another edition of Peak Life. I'm Jim Hazel. The holidays are almost upon us, which means the holidays are almost upon us. And we're going to talk a little bit about holiday stress and how to be healthy with that. And to help us do that is Dr. Tracy Richards. She's a behavioral health specialist, director, extraordinaire therapist from Chesapeake Regional. Thanks for coming.
Thank you for having me.
And so holiday stress, it's not just a new thing. It's been around, right?
Mm-hmm. Yes, but I think this year brings a new layer, right, of some things with the pandemic. We now have to follow CDC guidelines with hosting an event or not hosting an event, and how we're going to do it, and what additional guidelines we're going to have to follow to travel, to not travel, right? So lots of things.
Big decisions need to be made. And what do you think it is that we need to focus on in order to, I don't want to say get through the holidays, but to some people it can be very, very difficult.
Yeah, my key word here I think would be flexibility. We may have had rigid traditions that we've always done every year for the holidays, and this is going to be a year of flexibility, of creativity, and trying to find new solutions and new traditions.
There's a political aspect to this time and the pandemic as well. I know people say, oh, I've got to see so and so, or they don't want to get in an argument, or whatever. Do you have any advice for that? I mean, how do we talk to friends and family who we may not agree with?
Yeah, sure. My key here is don't go into those conversations thinking that you're going to win or thinking that you're going to prove the other person wrong. The best tip, I think, would be to go into those conversations with curiosity and openness and really try to understand the other person's perspective. Why do they think the way they think, and where did they come up with those ideas, and those kind of things. Genuinely curious.
And I guess that leads me to the term I hadn't heard before, toxic family members, all right? Is that a new thing, or is it just a way that people have addressed that very issue?
Toxic means different things to different people. Toxic certainly is on a spectrum, right? There's certain behaviors that we find difficult to interact with, and there are some that are just abusive, and that we have to create boundaries around, right? What is our line in the sand that we're not going to cross when it comes to those individuals?
Right. And then I guess for a lot of people, I know that this has happened in our family as well, is the holidays reminds you of loss or family loss. And that adds a whole nother dimension on not to say just stressful holidays, but actually depressing.
Absolutely. The holidays are a time where we typically think of family coming together, and when there's been a recent loss or just a loss of a loved one, we can't help but think that they're not there in those moments. So my best advice in that is to hold compassion for ourselves, right? To know we're going to be more vulnerable during the holidays to those losses, and to be proactive in taking care of ourselves.
And what else do you think we could really do to help us mentally, through I mean, there's healthy ways to deal with stress or depression, and there's unhealthy ways. I know flexibility is key, but what else could you offer there?
There's other healthy mindsets that are important to practice, right? So just like if you're learning a new language or juggling, you have to actually practice them to build those stronger neural networks. And some of those mental mindsets that are healthy is hope and gratitude. We sometimes think, once I'm happy, or once life is even and all things are working well for me, then I'll be grateful. But it actually works the other way around. So in order to be healthy, we want to first practice those healthy mental mindsets. And as you mentioned, there are some unhealthy ways. There's some unhealthy habits. We're familiar with some of them, right?
Well, you'd like eggnog, and is that what you're alluding to? Because I don't really like eggnog per se, but go ahead.
Well, substance use and alcohol.
It can go up as say people get stressed out or during the holidays.
Absolutely, and that's the function of stress, right? Our bodies are so wonderfully designed. When we're stressed, the brain has a function of trying to seek out comfort. So I don't know about you, but during the pandemic, I suddenly and mysteriously found myself opening the refrigerator door quite frequently, right? Mm-hmm. That's the brain trying to do its job, which is to bring comfort in those times of stress. And we can easily get into some of those unhealthy habits, substance use, alcohol, gambling, pornography. Those habits provide an immediate sense of comfort and reward, but they have negative long-term consequences that we really would do best to use a more healthy strategy that has that same immediate impact of providing comfort, but doesn't have those negative long-term consequences.
Right. So to recap, we're talking flexibility, especially with dealing with family members or other loved ones, and also because of the pandemic, right? I mean, we can't expect our holidays to be, you can't go back in a way. Is that what you mean?
Right, right. We have to be patient with ourselves and look for creative opportunities here, right? Think back to the high school graduations that those seniors didn't get to have because of the pandemic. So much of the stories that came from that were these creative solutions where their expectation of what they were going to get didn't happen, so they had to come up with a new plan, and it matched the spirit of what they wanted to get done, that closure of that time in their life and moving forward, and they did that creatively. And we have to do that with the holiday season. What is the spirit of the holiday season, and can we still accomplish that even though we have to think of new ways to do that?
Right. We might Zoom with Santa then.
Absolutely. FaceTime with Santa.
And if people really need help, I know there's a lot of services out there, especially with regional healthcare. Where do you think people should go? And I guess that might depend on their, where they are in that.
Certainly, there are levels of care. Some people may benefit from a therapist. Some people may be in a mental health emergency. If they're in a mental health emergency, they can certainly reach out to us. We have an emergency room that we always have a crisis clinician on hand who can help with that evaluation and get them connected to the level of care that they need.
And Chesapeake Behavioral Health Care also provides free services, and the hospital works with them at all, or how? What's the difference?
Absolutely. So Chesapeake Integrated Behavioral Health is like our local version of a community services board.
Right.
Well, they are a community services board. So individuals can go there for mental health services and free access, and they can help them get into services as well. Sometimes that's a more helpful route so that they don't incur an emergency room bill. So our system is designed to flow. Sometimes if they go to CIBH, they'll still be recommended to come to the emergency room because maybe we can help them more efficiently. So we have a good workflow. They can certainly navigate it with ease if they just come straight to our ED or call CIBH for that same day access.
That sounds great. Dr. Richards, going to stay flexible this holiday season, and don't expect too much, but still have fun over the holidays and be safe out there. Thanks for joining us again on Peak Life. I'm Jim Hazel. We'll see you next time.